Now let's discuss some psychological disorders and how our brain activity occurs when a disorder takes place. First, let's talk about substance abuse and addiction. The most commonly abused drugs are derived from plants, such as nicotine that comes from tobacco. An antagonist is a drug that's going to block a neurotransmitter because it's against the neurotransmitter, whereas an agonist is going to mimic the effects of a neurotransmitter, or it will therefore increase the effect. It's going to help the neurotransmitter along. A drug's effectiveness and side effects are going to vary from person to person. Some people are predisposed to alcohol or drug abuse due to genetics. Certain aspects of brain functioning and behavior are present from the start in people with a familiar disposition to addiction. But not all people who are genetically predisposed will develop addiction. Twin studies have shown us that there's a strong influence of genetics on vulnerability to drugs and alcohol. And there have been addiction linked genes identified that have a small effect on a person. And we know that societal expectations or the environment can also play a role. Prenatal environment contributes to risk for alcoholism. When alcoholics develop alcohol problems before age 25, they tend to have a family history and a genetic predisposition with a rapid onset of problems, often legally. There are also some behavioral predictors of abuse. The sons of alcoholics show less than average intoxication after drinking a moderate amount of alcohol. And those low levels of intoxication may influence a person to keep drinking because they think they're not intoxicated. Therefore, the probability of developing alcoholism is greater than 60% when that happens. Many people who use alcohol say that it's a stress relief. When it comes to your neurons and those synaptic mechanisms, nearly all people who abuse drugs have shown the effects of several kinds of receptors in those synapses. Dopamine has been shown to also play a role. The location where addictive drugs release dopamine and norepinephrine can be central to reinforcing those experiences in the nucleus accumbens. Dopamine can also be released in the nucleus accumbens during sexual excitement, listening to music, tasting sugar, imagining something pleasant, or engaging in habitual gambling and video game playing, all behaviors that can be addictive. So here's a picture to show you sort of the area of the brain where the nucleus accumbens is located, that small purple area. When it comes to cravings, that is when a person desires to have something. This is a distinctive feature for most addictions. Even after a long period of abstinence, there could be a trigger for a craving. A person tolerates a drug or alcohol when there's a decrease in the effect of the addiction. It's primarily learned, and it can be weakened through extinction. So that person may need more to get a desired effect. Withdrawal is the body's reaction to the absence of a drug or alcohol. And there is a hypothesis that a person with an addiction may use a substance to cope with stress and to also avoid the symptoms of withdrawal. So when it comes to treating drug addictions or alcohol addiction, some people are able to decrease use or quit on their own. Others have to go to Alcoholics Anonymous or Narcotics Anonymous. And cognitive behavioral therapy with rewards and punishments has also been effective for treating addictions. Medication usage is not as common, but there are some options available for medication use, such as Antabuse, which results in sickness or sick feeling after drinking. So it's inducing nausea so that the person will no longer associate pleasure with the substance. But for a lot of people, that hasn't been a popular thing. Naloxone is also a way to block opioid receptors and decrease pleasure for alcohol use. And that effectiveness is going to vary depending on a person's motivation to quit. Methadone has been used as a safe alternative for opiate abuse. It is similar to heroin and morphine. It's going to activate those same areas and can be taken orally, absorbed slowly, and leave the brain slowly as well. Mood disorders, or disorders that have a disruption in a person's mood, such as major depressive disorder. And this is when a person may not get out of bed. They'll feel sad. They'll feel helpless. They might feel fatigued and have trouble speaking or trouble sleeping, cognitive problems, low motivation. This is when a person is not happy and oftentimes with no cause. There has been a genetic link to depression as well. There's not one gene that's been identified as being clearly linked to depression, but people who have early onset depression, which is considered before age 30, are more likely to have relatives with depression or anxiety disorders or neuroticism, migraine headaches, and other mental health issues. And if depression has a late onset, which is considered after age 45, it might be linked to relatives who have circulatory problems. So there's a hypothesis that there are genes that vary depending on a person's environment. Many young adults with the short form of serotonin genes may experience stressful experiences and have an increased probability of developing depression. The left prefrontal cortex will show decreased activity when a person is depressed, and then there's increased activity in the right prefrontal cortex. People with depression tend to gaze to the left when asked to do a verbal task, although most other people will gaze to the right if asked to do a verbal task. Depression can be treated with antidepressant drugs, and there are a number of different categories of antidepressants. Tricyclics are going to block proteins that reabsorb serotonin and dopamine and norepinephrine. It can lead to drowsiness, dry mouth, difficulty urinating, and heart irregularities. SSRIs are going to block the reuptake of serotonin, and they are specific to serotonin, which we know is the mood stabilizer or impacts a person's mood, and most people are usually prescribed SSRIs if they suffer from depression, things like Prozac and Zoloft. SNRIs are going to block the reuptake of serotonin and norepinephrine. This is different from other antidepressants, and they can improve certain aspects of memories. So if SSRIs don't work, the doctor will find something that is better, such as maybe Cymbalta, which is an SNRI. MAOIs are going to block the metabolism of serotonin It can result in more transmissions at the presynaptic terminals and can result in high blood pressure if some foods are taken. So usually MAOIs are kind of a last resort. Atypical antidepressant drugs like Wellbutrin are also given. They can have milder side effects. And then ketamine is a newer substance used in the treatment of to be anti-depression. And it is something that produces rapid antidepressant effects in people who don't respond to other medications. So there are a number of different ways to figure out what's best. St. John's wort is a herb that's usually also used if a person doesn't want to take a psychotropic medication. It is not regulated, though, by the FDA, so its effectiveness is not well researched. The way antidepressants work as far as neurotransmitter transmission is that most people with depression have normal levels of neurotransmitters, but the drugs affect neurotransmitters in the synapses quickly, and that can result in improved moods. People with depression can show smaller than average hippocampuses, impaired learning, and reduced production of hippocampal neurons. That's why whenever you are depressed, it's kind of hard to have any positive memories. Proliferation of new neurons in the hippocampus is important for antidepressant effects to take place. And studies have shown us that antidepressants may not be helpful at all if a person is suffering from mild depression. If a person does not want to take an antidepressant drug, they can also go to therapy and receive cognitive behavioral therapy, which has been shown to be effective for the treatment of depression. Exercise has also been shown to help with depressive symptoms, and taking various vitamins or supplements has also been shown to increase a person's mood. Electroconvulsive therapy is another way to treat depression. Many people who experience depression have altered sleep patterns. They might fall asleep but awaken early, and they may have difficulty going back to sleep. They could enter REM sleep a lot sooner than normal. They might even experience sleep deprivation. Seasonal affective disorder is a mood disorder involving depression that can mostly occur in winter months or in places that don't receive a lot of sunlight. These people have phase-delayed sleep and temperature rhythms. Ultraviolet light therapy is often used as a treatment for seasonal affective disorder. And many people who develop seasonal affective disorder could have a mutation on a gene that's responsible for regulating their circadian rhythm. But of course, people can also experience seasonal affective disorder if they have cabin fever, if they've just been inside too long without any sunlight or vitamin D exposure. Deep brain stimulation has to do with implanting a battery-powered device into the brain to deliver periodic stimulation. This can increase activity as a result of antidepressant drugs. There's encouraging results, but not a lot of research has been done to look at its effectiveness overall. Unipolar and bipolar disorder has to do with altering states between normality and depression. So unipolar disorder has to do with a person being at baseline and sometimes experiencing depression. Bipolar disorder, which used to be called manic depressive disorder, has to do with alternating between states of depression and mania. Mania is a time of extreme excitement and feeling on top of the world. So somebody with bipolar disorder has extreme highs and extreme lows, and they're rarely at baseline unless they are medicated. Bipolar 1 disorder is characterized by full-blown episodes of mania. Bipolar 2 disorder has to do with hypomania, so milder manic phases. And bipolar disorder can usually occur in the early 20s or the late teen years. It has to do with the brain's use of glucose increasing during periods of mania and decreasing during periods of depression. Lithium is oftentimes the first treatment for bipolar disorder. It's a salt that can help stabilize a person's mood and prevent them from relapsing into mania or depression so they can stay at baseline. Other drugs, Depakote, have also been used as a mood stabilizer, and those drugs work because they decrease glutamate activity and can block brain chemicals from being inflamed. Schizophrenia has to do with the deteriorating ability to function in everyday life. It needs to take place for at least 6 months and can involve hallucinations, which are hearing or seeing things that are not actually there, delusions, which are unjustified thoughts or beliefs. It can involve disorganized speech and disorganized behavior, and the absence of emotions and speech and socialization. So a positive symptom occurs whenever there's something that's there that shouldn't be, like hallucinations and delusions and disorganized speech and behavior. A negative symptom occurs when something that should be there isn't, like affect and emotion and speech. Cognitive symptoms of schizophrenia have to do with difficulty using and understanding abstract concepts, and it could be due to impairments in attention and working memory. There are many conditions that can resemble schizophrenia. There's something called substance induced psychosis that could appear to be schizophrenia. Brain damage, undetected hearing deficits, Huntington's disease, and nutritional abnormalities can also lead to psychosis. But in reality, only about 1% of the population of the world has schizophrenia. It's more common in men than women, but can occur in all ethnic groups. Men are more likely to develop schizophrenia in the early or in the 20s, whereas women are more likely to develop it in the 30s. We do know that there's a genetic component for the development of schizophrenia. It does not depend on a single gene. And when it comes to the environment, adopted children's studies suggest a genetic role. The environment is going to influence, how the family responds. But we know that the prenatal environment of the biological mother cannot be discounted as playing a role as well. There are many genes that are more common in individuals with schizophrenia, and a large number of those genes produce small effects. Abnormalities that occur during prenatal and neonatal nervous system development could play a role as well. People with schizophrenia have minor brain abnormalities that originate early in life, and those abnormalities of early development could impair behavior in adulthood. Now, research as to why some of those effects don't appear to adulthood is lacking. So there are some prenatal and neonatal environmental factors that could play a role in the development of schizophrenia, such as living in a crowded city. Those are going to have an intermediate effect. Some low risk factors might have to do with poor maternal nutrition, premature or low birth weight, complications during deliveries, head injuries, extreme stress during pregnancy for the mother. Mother-child blood type differences could increase the likelihood of schizophrenia. If the mother has Rh negative blood type and the baby is Rh positive, the child has about twice the probability of developing schizophrenia. The season of birth effect is the belief that people born in winter months have a slightly greater probability of developing schizophrenia. And that is oftentimes thought to be due to viral infections in the mother. So we know that there's a wide variety of genetic and environmental influences that can cause schizophrenia. But what causes it in one particular person is oftentimes unknown. Mild brain abnormalities can also occur with people who have schizophrenia. We know that there's less gray matter and white matter. There are larger than average ventricles. There's a smaller hippocampus. And there are deficits of memory and attention that are consistent with damage to the prefrontal cortex. When it comes to brain lateralization, there's differences in people with schizophrenia. The right temporal lobe might be slightly larger, and there might be lower than normal activity in the left hemisphere. People with schizophrenia can also tend to be more likely to be left-handed. So, as it was first developed, schizophrenia was thought to be a progressive disorder. But now we know that people who are diagnosed with the disorder are going to vary in their outcome. It may not necessarily be as progressive as it was once thought, because other environmental factors can also impact a person's ability to function. As I said earlier, most cases of schizophrenia are not diagnosed until age 20 or later. And that might be due to developmental things going on with children involving impulse control, attention and memory, and those things being focused on instead of other risk factors. In order to treat schizophrenia, antipsychotic medications are often used, like Thorazine. That can help with the decreased hallucinations and delusions. Other medications can also be used to block dopamine synapses, because we know that there's a dopamine hypothesis that tells us that schizophrenia results from excess activity of dopamine in areas of the brain. And I spoke earlier about substance-induced psychosis, which can involve symptoms of schizophrenia due to drug use. And sometimes, depending on the drugs that were used, they can lead to permanent psychosis. We know that people with schizophrenia have twice as many D2 receptors that are occupied than normal people. So that's why we know there's a dopamine hypothesis. The mesolimbial cortical system also shows a set of neurons that project from the midbrain to the limbic system and prefrontal cortex. There are drugs that can block dopamine in those systems and result in tardive dyskinesia, which are tremors and involuntary movements that can exist when some antipsychotic drugs are taken. Atypical antipsychotic seldom produce movement problems like tardive dyskinesia, and these are the drugs that are more likely to be prescribed for somebody who has psychosis. However, they do have side effects. They can cause weight gain, immune system impairment. There's also a glutamate hypothesis, which says that problems relate to deficits in activity of glutamate synapses. And dopamine is going to inhibit that glutamate release because there's so much dopamine in the brain. PCP shows support for the glutamate hypothesis, which is going to be a drug that inhibits the NMDA glutamate receptors. When it's taken at larger doses, it's going to produce both positive and negative symptoms of schizophrenia, and it can lead to permanent psychosis. Autism spectrum disorders includes autism and what used to be called Asperger's. Now we say that a person is on the spectrum because they can range in abilities from mild to severe. A long time ago, autism spectrum disorders were not diagnosed as much. Now they're commonly diagnosed and more common in boys than girls. This disorder shows people with this autism spectrum disorder show deficits in social and emotional exchange. They can also have deficits in nonverbal communication, repetitive movements, resistance to change and routine, and unusually weak or strong responses to stimuli. Infants with autism make a normal amount of eye contact at 2 months, and then it tends to decline. There could be genetic and other causes. It could be based on genes, and it also could be based on mutations and microdeletions of genes. Some mothers of children with autism have antibodies that attack certain brain proteins. It might also be because of prenatal nutrition and not getting an adequate amount of folic acid. To treat autism spectrum disorders, it's mostly involves social behavior and communication management. Taking Risperdal can sometimes reduce stereotyped behaviors, but it can also have serious side effects.